Thank you, Lisa. First of all, good morning, buenos dias. That's my city, so it's a pleasure for me to be here. And I am very grateful for the invitation of Johan and Martin to this event, because, and Martin raised this word in one of her last slides. That's about cooperation. And that's the most important word we have to use. All this idea of the networks started with a very simple idea: why we are not cooperating, why all doctors and healthcare professionals in Europe are not able to work together to tackle complex or rare medical diseases, as it's the case of primary immunodeficiencies. And that started in 2000 around, the idea, to explore the idea. Because here the idea was not to have a project, a research project, or a collaborative project, which are very important. But usually, as you know very well, there is a problem of sustainability and of the integration of these projects with the healthcare systems, with the everyday practice of the clinicians and with the everyday needs of the patients. And that was the idea, to create an institutional system. So we are part of the healthcare system. The difference is that we are talking about something that is quite strange in the European Union, is to have something at cross-border level, a healthcare system at cross-border level that it's so like the way to support, to integrate, to make interaction between all the healthcare professionals, the hospitals in Europe. What the networks are doing, the networks are, and that's very important, and it's related with one of the aims of your conference. The main element, the main goal of the networks is to improve the healthcare. And when we are talking about improving the healthcare, we are talking about improving the quality of life, the diagnosis, the treatment of the patients. And the networks are not only cooperating in many areas. Here you have some of the elements. Of course, the networks are doing research, are generating knowledge by doing clinical guidelines, by doing protocols, by doing consensus statements, and also are working very hard, and that's one of the very important elements, on improving the training and the learning on rare and complex diseases, where, as is in your case, the knowledge is scattered, and the number of patients in many of the diseases are so low that the member states itself are not able to concentrate the care to have all the information. This is a real example of the added value of working together in the European Union. But the main, as I said, the main focus is on the clinical cases. And the networks are discussing patients, individual patients. We are having a virtual online tool that allows to share all the clinical information, to establish web conferences, and to provide advice to the doctors that are proposing a patient to be discussed. Like in a normal clinical session in any hospital in Europe, but at European level, which is, I will say, I am completely honest to you, very complicated. Very complicated, but because it's new. It's new for everyone. It's new for the clinician, it's new for the institutions, it's new for the patients. And we are building a system since then to be able to have a mature system that will stay, that will not finish after 5, 6 years. That will stay forever if we are, and that's very important, able to demonstrate the value of the networks. We have a legal base, which is fundamental, because in the European Union, here are people of other countries, other continents in the European Union. We have a strong organization, but healthcare in principle is a matter of subsidiarity, so the member states are responsible. This is the only legislation at European level that establishes that we are working together in clinical care at cross-border level. And we have many elements that are the key assets of the network. We have the networks, and the aim of the networks, as is the case of IPOPI, are recognized as a value, as a need. We have a strong political support from at the European institution, at the European Parliament, at the national, with the national authorities. And one very important thing, that's again about cooperation, all the players are feeling the ownership of this idea. And it's the only way that that will work. We started in 2016. Many of you are familiar with that, so sorry for repeating, but probably for other participants here, you are not knowing exactly what we are talking about, so I will make a brief explanation. We started with a call for creating European reference networks for more than 6,000 rare diseases that are more or less identified. And with this call, we were able to, not the institution, but the healthcare professionals, but the patient association working together to make 24 proposals of networks that were approved. And now the system of the networks are including 300 hospitals in Europe and more than 900 healthcare units. That was launched in 2017. So we are talking about something that is very young. Very, very young, so only 2 years since the beginning of the process. We have a very strong assessment system to identify if the centers, the healthcare units that are participating are fulfilling all the requirements. You can see in our webpage there are very strong requirements. It's very exigent to be in the networks because the idea is to have not the best one, because there are many other hospital units that are not in the network, but some of the best one, so working together and with the idea to create an environment at network level. Now we are in the process of expansion. We have also other figures different to the full members of the network, which are called as the affiliated partners, which are very good centers, very good units, but probably with less experience, less cases, in some member states where the capacity to interact with the networks, it's more complicated. Now we have 250 designated affiliated partner units, and now we are in the middle of a new call for new members to join the networks that was launched 1 month ago. So we hope that with this call, we will cover to all the networks, to the 24 networks, all the countries in Europe and all the possible diseases. That's our aim. Here you can see the list of the networks. We are covering, I would say that we are missing rare infectious diseases and probably rare gynecologic diseases because are only partially addressed, but we are covering all possible domains of the knowledge in medicine. And of course, we have one very important network, you know them very well, RITA, which is dealing exactly in one of the 3 strands. They are organized with primary immunodeficiencies. Also, they are dealing with autoimmune diseases, systemic autoinflammatory disorders, and also with a very strong pediatric rheumatologic approach to this. Here, the networks, there are 24 centers, units, and as you know, the coordinator now is Nico Bulfrat in Netherlands. The previous coordinator, who was in the UK, unfortunately, with the situation of the Brexit, we are losing the UK providers. That will be a disaster for everyone. So that's my personal opinion. That's not an institutional declaration, but I am working with them every day. And that's a complete disaster. So it's the only thing I can say. Key achievements. Now we have the networks working. They are doing clinical care. They are treating patients. But at the same time, they are also developing a very complex governance structure to put all these different members in all the different member states together. And there are a huge development now of training, learning activities. Many clinical guidelines have been already developed, and we are working now in the development of patient registries. The 24 networks are now applying for having each of the networks a patient registry, and the expectancy of that is being able to have better data, more data, and to reach new evidences, and of course with that new treatment, new diagnostic techniques. We are now at this stage of the development. This is the cycle of the networks. We started with the legislative proposal in 2011. Now we are in the consolidation phase. We will evaluate that in the next years, and the idea is to show to all of you, to the politicians, to the national authorities, that the networks are a success and will improve the life of the patients, the quality of life, but also will support the healthcare system in their capacity to treat all the patients at national level. Thank you very much.